Welcome to Adapting class. Guys, most students fail the NCLEX because they study everything instead of studying what actually shows up on the NCLEX. But what if I tell you that the NCLEX literally give you the exact breakdown of what will be tested? In this video, I'm going to go through, show you how you can use this NCLEX test plan to pass your NCLEX for 2026. Don't worry about the changes. Stick with this plan and you'll be able to pass the NCLEX. At the end of the video, you will see the perspective of what you need to do and get yourself ready to get this thing done. The first thing I want you to know is NCLEX is not a random test. Therefore, don't study everything. It's not a random test. Don't study everything because what? You need to study smart and you don't study too hard. That means don't kill yourself. Focus on specific information and you'll be fine. This is the problem. This is your test plan. The NCLEX has given you a blueprint. This blueprint is right there in front of you. You know what to focus on and you know what you need to do. As you can see, the distribution of the context for the test, for the RN test, is the same thing as the PN. You're going to have physiological adaptation, 14%, management of care, 18%, reduction of risks, right? Risk reduction potential, 12%. Pharmacology and parenteral therapies, 16%. Safety infection, 13%. Health promotion and maintenance, 9%. Psychological integrity, 9%. Basic care and comfort, 9%. If they give you this, they're telling you, they're screaming at you that, hey, this is what you need to do. If you take exactly 85 questions, I can tell you the breakdown. You're going to get 15 questions from management of care. 15. You're going to get 11 questions from safety if you calculate it. You're going to get what? 8 questions from health promotion. That is maternity, right? And then peds and newborn. You're going to get 8 questions from psychology, psychosocial integrity. Basic care and comfort, 8 questions exactly. And pharmacology, you're going to get 14 questions. Risk reduction, 11. And then physiological adaptation, 10 questions. That tells you pharmacology, risk reduction, physiological adaptation, management of care, and what? Plus and minus safety. This is your biggest power. But it doesn't mean you should ignore the easy points you're going to get from psychosocial, basic care and comfort, and air promotion. But this is just a framework. Like if you want to have more than 50% of the answer right and be prepared more than 50%, this is your blueprint to get to 50% ready. This is the same distribution. And I'm saying this is not random, no matter how hard your question is. I've heard people say, I had a lot of maternity. Well, guess what? They can ask you maternity pharmacology. They can ask you maternity physiological adaptation. They can ask you maternity management of care. They can ask you maternity safety. They can ask you may be seeing a bunch of maternity questions, but guess what? The distribution is the same. Therefore, you have to recognize that, oh, this is a maternity, but they're not just asking me about maternity. They're asking me about safety associated with it. They're asking me about risk reduction. I'm not going to prevent harm to the mother. They're asking me about if the harm already occurred, how can I prevent and take care of it? Physiological adaptation. They're asking you about medication to prevent risks to the mother. You see, getting a bunch of cardiology does not mean the test is full of cardiology. The distribution has to be perfect for it to be still the NCLEX. They have to stick with this test plan, no matter what your test is, no matter how many case study they give you. They can give you a bunch of case study, but they are all what? Maternity, they're dealing with specific topic. You got it. Therefore, these are my tips for you. Number 3, pharmacology. Master them. How do you do? What do you going to do to master pharmacology? This is one of the highly tested area. There's so many medications. This is why Adaptation focus on a bunch of maternity pharmacology practices so that you can be familiar. But just not knowing the medication is not enough. I focus on what? Side effect, toxicity, some antidote, and the nursing intervention. Just knowing that this is lisinopril is not enough. Be able to know that what are the things the NCLEX will ask me. What is a teratogenic medication? What? It can cause hyperkalemia. How would I identify it? Muscle cramp. How would I identify that, oh, the patient who is taking this medication is pregnant, and therefore you got to intervene. Angioedema, they tell you their lips is swollen. All these little clues, this is what you need to do, not just the medication. Don't memorize it. Pay attention to that. But make sure before you take the test, this is your bulk of your test, 13 to 19%. You expect to get what? Over 14 questions. That's a lot. If you're taking 85 questions, just for the 85, 14 questions is coming from pharmacology. Don't panic. I got you. And if you really master pharmacology, you are already halfway passing. Therefore, if you're struggling, check a doctor class, bunch of video, playlist, watch them, practice the questions, and you'll master them. Number 4, physiological adaptation. This is big. What it means is involve most of what? Med-Surg, all the things you know about it. But that doesn't mean you should memorize every concept in Med-Surg. Be able to identify that, oh, something is bad or is already happening. How can I fix it? They're asking you, can you save the patient? That's all. Physiological adaptation means, can you save the patient? Patient has a condition, is in trouble. Can you save them so that they don't die? That's all. So think about conditions about shock, right? Sepsis, ARDS, DKA. This is where it comes. So your cardiology, your lung, your respiratory concept, your IV fluid, all those things, electrolyte changes. How can I maintain the individual who has hyperkalemia? What is the first thing I would do so that they don't die? I put them on what? Cardiac monitor, and I start monitoring their what? Management of their hyperkalemia. That when they give me K-Acylate, I know K-Acylate is not going to solve the problem right away. I need some insulin and glucose. You're thinking critically and you're trying to save the patient. It's a form of prioritization. They are part of the prioritization. When you say you have a bunch of prioritization questions, sometimes most of them are physiological adaptation. We want you to do something not to kill the patient. Patients already have a problem. It's in shock. Save them. That is what it is asking. But their friend is the most tricky one. And that's the friend. I call it risk reduction. Reduction of risks. I don't want you to get into trouble before so that I can institute my knowledge on physiological adaptation. I want to prevent that risk. This is why this portion is a little bit tricky. 11 questions from that. 9 to 15%. You're going to get 11 questions. And what does that mean? Is to, when you see it, you should act fast. That's the thing. When you see the question and they said, hey, the nurse need to intervene, they're referring to you risk reduction. It also look like what? Prioritization, but it's not true prioritization. A true prioritization will say, who do you see first? They give you a bunch of patients. But risk reduction and physiological adaptation, they're trying to let you prevent, immediately notify the provider, do something. When you see this kind of question, think about it. I need to answer them well because they are big. They are risk reduction. So what are we looking for? We're looking for lab work that is a problem. We're looking for complications. We're looking for monitoring the patient so that they don't get sick. So when your glucose is high or their glucose is low, you know I need to give them, okay, sugar so that they don't get sick. If they they are hypoglycemic, I know I see signs and symptoms of hypoglycemia. I have to treat them right away without waiting for orders. All those things you are doing what? Risk reduction. So potassium abnormality, all those post-op complication, all medication side effects that you're providing, you're teaching the patient, This is risk reduction. Know them. Plan your study appropriately. Of course, you can sleep on this. This one, basic care and comfort. It's not that big. You're going to get like 8%, 6 to 12%. That means in 85 questions, 8 questions. These are free questions. They are free for you to get it. They are easy point. Trust me. When you do them, you can see that some of the things you know them already. If you sleep on them, please, you're going to mix them. Know your pain, right? Some of the things, easy point, you don't mix them, right? Pain associated for the individual, prevention of DVT, hygiene, positioning, comfort care, end of life care, all these things, little things that is very, very natural that you do all the time, providing hygiene to the patient. The certain things, it's a basic care on comfort. That is the big nursing care for the patient. You know it, but don't mix them. Don't ignore them. It's less point, but 8 points can change everything for your test. And this is where you fail or pass. Once again, whether you fail the test or you pass is this. This is one of the things that kill people. This is it. Management of care. He has what? Big, and it contains large portion of your test. And you can see it is the most important of the test. Whether in the case study form, you cover everything. What are we talking about? Prioritization. Who do you see first? Delegation, leadership. Master them. Adapting care strategy is a bishop, not an expected finding. You know that the certain things that will sound like bad. COPD patient, his SAT is 89. But that's what he leave. Therefore, what are you going to do? Ask my patient. I give them albuterol. They tachycardic, palpitation. Of course, they're not dying, right? But if you have CHF and you have pink fluid sputum, I say, whoa, no, that's not what you should expect. I know there's a bunch of CHF patients. They have leg edema. They have ascites. Those are fine. As soon as I see pink fluid sputum, I say, boom, hey, I got to pick you. This is prioritization. It's testing you, how you can save the patient, whether you know this patient is in trouble. So know them. Now, of course, you should not sleep on what? Delegation and assignment. I know there's a bunch of videos out there. There's a bunch of things. There's so many lists that you can use to do your delegation. But there's a simple one Adaptation will give you. He said, what? RN, simple. Everything. You can do everything, right? But just make sure that when you see assessment, evaluation, teaching, first of everything, give it to the RN. The LPN, I say what? Don't memorize those lists. Just say MMR most. What does that mean? They can give most medication. If I look for adjective for LPN, when I'm answering question, I'm looking for adjective. What? Monitor, reinforce, right? Those are the big words. I'm monitoring and reinforce. I'm providing teaching that was already taught, reinforcing it. And some few information. Most medication, that means I can give every medication except high maintenance medication. You need to know all the list of medication? No. And the few one is tube feed and stomach. So if I can give anything that has stomach, gastrostomy, tracheostomy, urostomy, I can do that. I can provide education regarding after the RN has done that. But reinforcing and then monitoring things that has been done is the LPN. UAP. I say anything that does not require thinking and ADL. If you say go check the vitals, I don't even have to worry. I grab the machine, I check it. And then if they need to go to the bathroom, I walk them. That's all. Big, 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 right? 15 questions, 15 to 21%. You're going to get 15 questions from it. Just master them. Now, infectious control, I feel like this is also freebie if you know how to approach them. The reason why the NCLEX ask them is because people overselect. I've seen in my Q bank, at that NCLEX Q bank, I see people make certain mistakes because over selection. If I give you a droplet precaution, influenza. And I said, what kind of PPE you need? Then you over-select. Okay, you wear gloves, you wear gown. All you need is what? Surgical mask. When the NCLEX is talking about infectious control, they're talking about what? Not the primary prevention, it's the secondary aspect of it, right? Specific to the organism. So the only PPE you need for airborne, you don't need gloves. Don't pick gloves. It's what? N95, that's all. I know you got to wear gloves to do things, but when they ask you, they're looking for specific for that organism. Don't sleep on them. Look at it. How many questions? Freebie, 11 questions from me. Know them airborne, know them droplet, and contact. Once again, do not overselect. Number 10, health promotion. This is a little bit, it feels like, oh, there's a few questions, 6 to 12%. That means 8 questions. But when the NCLEX figure that you have poor knowledge on what? Peds and what? Maternity and health promotion, they can ask you physiological adaptation question, but still under maternity. Tests feel like a bunch of maternity, but no, it's just testing you all the areas, but under maternity, right? That is how sometimes you feel like, oh, I have a lot of what? Respiratory questions. No, it's because they're testing the same content, physiological adaptation, risk reduction, all the things under that prioritization, under that particular subject, they figure out that you're weak. But look, maternity, peds, they're going to ask you questions. Don't sleep on them. Like I said, it doesn't cover a lot of the test. It's about 8 questions for me. But that 8 question can change the whole test. If you mix all of them wrong, you get all of them, then the computer will figure it out that, A, you're weak in maternity. So when they ask you pharmacology question, guess what? They go into maternity. They dig in. But just know that they exist, and therefore you got to master them. These are PEDS, milestone, teaching, and screening. Of course, mental health. You see, there's a bunch of pharmacology there. There's a bunch of concepts there, right? Also, you're going to get like 8 questions, but most of the time, a pure psychology question, psychosocial question is about what? Therapeutic communication. And so learn how to answer them. Tell me more. The rest may be under pharmacology, but remember, they can ask you case study and still be part of what? Psychosocial integrity. And therefore, the test is predictable, but it depends on what you do. Therefore, if you want to pass, I want you to focus on the high-end area when you're studying. And so that's what I call focus on a high yield fact. And that's what Adaptation class focus on. If you watch my videos, you see I focus on high yield facts so that you can pass the NCLEX. And these are really big. Check my channel. You see a bunch of topics that you need to know and a bunch of questions. Do them. And how do you know you're ready? I have a bunch of 85 NCLEX practice question readiness. If you're ready to pass the NCLEX, this is not only knowing everything, but test yourself whether you're ready. If you want to know, I actually have a bunch of them. I'm going to link it to the video. The next screen that you're going to come on the screen is an 85 question. Test yourself whether you're ready. It has the same distribution as we've discussed. And see how much you got. If you get over 65, that means you're ready. But keep on doing it. The areas you're weak, boost yourself up. Pay attention. Keep track of your record. This is the way to pass the NCLEX. Don't panic. Make sure those big areas, pharmacology, management of care, and what? The big area, like I said, physiological adaptation, risk reduction, know them. If you know them, you are more than 50%. But you can see that risk reduction and physiological adaptation, there's no topic. It's everything under what? Everything under message. But bring your prioritization together and use them to answer them. Thank you for watching. If this video helped you, just put a small comment and then subscribe to Adaptation class for more content. But like I say, 85 question is going to show up look at it, click on it, and see, test yourself. See whether you're ready. I know you're ready after you watch this video, and I know you gain something. Take care of yourself, and bye.